When I worked inpatient on a dual diagnosis unit, I repeatedly heard the complaints of patients with addiction. They would be infuriated that their prescribers had taken them off of the ADHD medications that they relied upon to function. And while the verbal abuse that often got placed onto the nurses who dispensed that unit's medication was uncalled for and hard to witness, it wasn't hard to understand the frustration of the patients in question. These were victims of prejudice, being judged based upon the diagnoses that they had been given, and not seen as individuals who were able to build up the courage to get themselves into treatment. This assumption of med-seeking behavior, which is all too common amongst treatment providers working with addicted populations, is a disincentive to receiving treatment, which is an unacceptable outcome for facilities designed to promote self-improvement and alleviate psychological suffering. The first step in understanding this topic, and the first takeaway that I would like the audience to have from this TED Talk, is that adult ADHD has detrimental effects on functioning, productivity, and self-esteem. Common symptoms of adult ADHD include a lack of organization and a tendency to be consistently late for important events or deadlines, which can derail careers and ruin relationships. The frustration and pain that this causes individuals with this condition is easily overlooked and is a large factor in the increased rate of addiction amongst the ADHD population when compared to that of the general public. The prevalence among people with ADHD to have alcohol abuse issues is 5 to 10 times greater than it is in the general population, and up to 25% of people treated for alcoholism and chemical dependence have been given a diagnosis of ADHD. The second takeaway that I would like the audience to leave this TED Talk with is that stimulants are the most effective medicinal treatment that we have in order to alleviate the symptoms of adult ADHD. Research has actually shown that in people with ADHD who take stimulants when they are younger are less likely to form substance abuse issues later on, which is potentially due to the minimization of symptoms and resulting need to cope. For those already addicted, I'd like to propose that the most effective treatments, these stimulants, may similarly alleviate the need to cope and thus prevent relapse in those who have already developed a chemical dependence of some kind. So why do so many clinicians take such a rigid and judgmental stance on issuing prescriptions for stimulant-based ADHD medications? Well, stimulants themselves can be addictive due to their resulting dopaminergic increases in the reward centers of the brain. In addition, in their short-acting form and in higher doses, stimulants can produce an effect similar to cocaine, which, as you can imagine, could be a serious issue for people already known to have a tendency towards substance abuse. In fact, many of the most popular ADHD medications hold the word amphetamine right on their labels, which can be more than a bit concerning. The third and final takeaway that I would like the audience to retain from this presentation is that there are simple ways to produce and administer stimulant-based medications in a manner that can minimize the potential for their abuse. The first is to make a coating on the medication that won't allow nasal ingestion, such as is done on Concerta. Some medications, such as Adderall, even have a sweet taste that incentivize excessive use. Next would be drug screening, which can be used to ensure that patients in treatment can be verified as the ones taking their medication, and that they are not being stockpiled or sold. Finally, the long-acting form of the drug can be used, which takes away the potential for abuse that occurs with the take-as-needed model. I know that it can be frustrating being lied to and being fooled by med seekers, but do your best to remember that adult ADHD is a real diagnosis that induces real suffering, and that by making adjustments in administration, we can focus on alleviating that suffering to the best of our abilities while tempering the threat of further addiction. Thank you for your time, and I hope that you have learned something here today.